Let's explore the topic of substrate depletion and repletion during exercise and understand how it affects performance and recovery. Energy substrates are molecules that provide the starting materials for bioenergetic reactions in our bodies. These substrates include phosphagens, which are adenosine triphosphate and creatine phosphate, glucose, glycogen, lactate, free fatty acids, and amino acids. During various activities of different intensities and durations, these substrates can be selectively depleted. When substrates are depleted, the energy that can be produced by the bioenergetic systems is reduced, leading to fatigue. Fatigue during exercise, it's often associated with the depletion of phosphagens and glycogen. In contrast, substrates such as free fatty acids, lactate, and amino acids typically do not deplete to the extent that performance is limited. Therefore, the patterns of depletion and repletion of phosphagens and glycogen following physical activity are crucial in exercise and sports bioenergetics. Fatigue during exercise is at least partially related to the decrease in phosphagens, namely adenosine triphosphate, ATP, and creatine phosphate, CP. So, phosphagen concentrations in muscle are more rapidly depleted as a result of high intensity anaerobic exercise compared to aerobic exercise. Creatine phosphate can decrease markedly by 50 to 70% during the first stage of high-intensity exercise of short and moderate duration, typically lasting 5 to 30 seconds. It can be almost completely depleted as a result of very intense exercise, leading to exhaustion. So muscle ATP concentrations may decrease only slightly or may decrease up to 50 to 60% of pre-exercise levels during experimentally induced fatigue. It's important to note that dynamic muscle actions, which produce external work, use more metabolic energy and typically deplete phosphagens to a greater extent than isometric muscle actions, where the muscle length does not change. The intramuscular ATP concentration is largely sustained during exercise due to CP depletion and the contribution of additional ATP from reactions like the myokinase reaction, as well as the oxidation of other energy sources such as glycogen and free fatty acids. Post-exercise phosphagen repletion can occur relatively quickly. Complete resynthesis of ATP appears to occur within 3 to 5 minutes, and complete CP resynthesis can occur within 8 minutes. Repletion of phosphagens is largely accomplished through aerobic metabolism, although glycolysis can contribute to recovery after high-intensity exercise. The effects of training on concentrations of phosphagens are not well understood. Aerobic endurance training may increase resting concentrations of phosphagens and decrease their rate of depletion at a given absolute submaximal power output, but not at a relative submaximal power output. Although some researchers have noted increases in resting concentrations of phosphagens, short-term studies of sprinting and 6 months of resistance or explosive training have not consistently shown alterations in resting concentrations of phosphagens. However, total phosphagen content can be larger following sprint training due to increases in muscle mass. Resistance training has been shown to increase the resting concentrations of phosphagens in certain muscles. After 5 weeks of training, the increases in phosphagen concentration may occur due to selective hypertrophy of type 2 fibers, which contain a higher phosphagen concentration than type 1 fibers. Glycogen stores in the body are limited and are available for exercise. Approximately 300 to 400 grams of glycogen are stored in the body's total muscle and about 70 to 100 grams in the liver. Resting concentrations of liver and muscle glycogen can be influenced by training and dietary manipulations. Research suggests that both anaerobic training, including sprinting and resistance training, and typical aerobic endurance training can increase resting muscle glycogen concentration when accompanied by appropriate nutrition. The rate of glycogen depletion is related to exercise intensity. Muscle glycogen is a more important energy source than liver glycogen during moderate and high intensity exercise. Liver glycogen appears to be more important during low-intensity exercise, and its contribution to metabolic processes increases with the duration of exercise. Increases in relative exercise intensities of 50, 75, and 100% of maximal oxygen uptake result in increases in the rate of muscle glycogenolysis, the breakdown of glycogen, of 0.7, 1.4, and 3.4 millimoles per kilogram per minute, respectively. At relative intensities of exercise above 60% of maximal oxygen uptake, muscle glycogen becomes an increasingly important energy substrate. The entire glycogen content of some muscle cells can become depleted during exercise. Relatively constant blood glucose concentrations are maintained at very low exercise intensities, below 50% of maximal oxygen uptake, due to low muscle glucose uptake. As duration increases beyond 90 minutes, blood glucose concentrations fall, but rarely below 2.8 millimoles per liter. Long-term exercise over 90 minutes at higher intensities above 50% of maximal oxygen uptake may result in substantially decreased blood glucose concentrations due to liver glycogen depletion. Hypoglycemic reactions may occur in some people with exercise-induced blood glucose values less than 2.5 millimoles per liter. A decline in blood glucose to around 2.5 to 3.0 millimoles per liter results from reduced liver carbohydrate stores and causes decreased carbohydrate oxidation and eventual exhaustion. Very high-intensity intermittent exercise, such as high-intensity resistance training, can cause substantial depletion of muscle glycogen, decreases of 20 to 60%, with relatively few sets, which means low total workloads. Although phosphagens may be the primary limiting factor during resistance exercise with high resistance and few repetitions or sets, muscle glycogen may become the limiting factor for resistance training with many total sets and larger total amounts of work. This type of exercise could cause selective muscle fiber glycogen depletion with more depletion in type T2 fibers, which can also limit performance. As with other types of dynamic exercise, the rate of muscle glycogenolysis during a resistance exercise depends on intensity. The greater the intensity, the faster the rate of glycogenolysis. However, it appears that when the total work performed is equal, the absolute amount of glycogen depletion is the same regardless of the intensity of the resistance training session. Repletion of muscle glycogen during recovery is related to post-exercise carbohydrate ingestion. Repletion appears to be optimal if 0.7 to 3.0 grams of carbohydrate per kilogram of body weight are ingested every 2 hours following exercise. This level of carbohydrate consumption can maximize muscle glycogen repletion at 5 to 6 millimoles per gram of wet muscle mass per hour during the first 4 to 6 hours after exercise. Muscle glycogen may be completely replenished within 24 hours, provided that sufficient carbohydrate is ingested. However, if the exercise has a high eccentric component associated with exercise-induced muscle damage, more time may be required to completely replenish muscle glycogen. Factors that limit maximal performance must be considered when examining the mechanisms of fatigue experienced during exercise and training. Understanding the possible limiting factors associated with a particular athletic event is essential when designing training programs and attempting to delay fatigue and enhance performance. Glycogen depletion can be a limiting factor both for long duration, low intensity exercise supported primarily by aerobic metabolism and for repeated high intensity exercise supported primarily by anaerobic mechanisms. Of importance to resistance training, sprinting, and other primarily anaerobic activities is the effect of metabolic acidosis on limiting contractile force. Several other factors have been implicated in the development of muscle fatigue and may limit exercise performance, including increased intracellular inorganic phosphate, ammonia accumulation, increased adenosine diphosphate, and impaired calcium release from the sarcoplasmic reticulum. Further research is needed to fully understand the causes of muscular fatigue and the limiting factors in exercise performance. Oxygen uptake or oxygen consumption measures a person's ability to take in oxygen via the respiratory system, deliver it to the working tissues via the cardiovascular system, and utilize it in the working tissues, predominantly skeletal muscle. During low intensity exercise with a constant power output, oxygen uptake increases for the first few minutes until a steady state of uptake is reached. This steady state occurs when oxygen demand equals oxygen consumption. At the start of an exercise bout, however, some of the energy must be supplied through anaerobic mechanisms because the aerobic system responds slowly to the initial increase in energy demand. This anaerobic contribution to the total energy cost of exercise is termed the oxygen deficit. After exercise, oxygen uptake remains above pre-exercise levels for a period of time that varies according to the intensity and length of the exercise. This elevated post-exercise oxygen uptake has been termed the oxygen debt, recovery oxygen, or more commonly, excess post-exercise oxygen consumption, abbreviated as EPOC. The EPOS is the oxygen uptake above resting values used to restore the body to its pre-exercise condition. So only small to moderate relationships between the oxygen deficit and the EPOC have been observed. The oxygen deficit may influence the size of the EPOC, but the two are not equal. Factors responsible for EPOC include replenishment of oxygen in blood and muscle, ATP and CP resynthesis, increased body temperature, circulation, and ventilation, increased rate of triglyceride fatty acid cycling, increased protein turnover, and changes in energy efficiency during recovery. During exercise, anaerobic mechanisms provide much of the energy for work if the exercise intensity is above the maximal oxygen uptake that a person can attain. Generally, as the contribution of anaerobic mechanisms supporting the exercise increases, the exercise duration decreases. The approximate contribution of anaerobic and aerobic mechanisms to maximal sustained efforts can be demonstrated with examples. For maximal efforts lasting up to 60 seconds, anaerobic mechanisms are the primary energy suppliers. Beyond 60 seconds, aerobic metabolism becomes the primary energy supplying mechanism. The contribution of anaerobic mechanisms represents the maximal anaerobic capacity. Appropriate exercise intensities and rest intervals can allow for the selection of specific primary energy systems during training for specific athletic events. A few sports or physical activities require maximal sustained effort to exhaustion or near exhaustion, such as competitive middle distance sprints ranging from 400 to 1,600 meters. Most sports and training activities produce metabolic profiles similar to a series of high intensity, constant or near constant effort exercise bouts interspersed with rest periods, such as in American football, basketball, and hockey. In this type of exercise, the required intensity that must be met during each bout is much greater than the maximal power output that can be sustained using aerobic energy sources alone. Increasing aerobic power through primarily aerobic endurance training while simultaneously compromising or neglecting anaerobic power and anaerobic capacity training is of little benefit to athletes in these sports. For example, it would be of little benefit for a baseball player to run miles during training rather than focusing on exercises that improve anaerobic power and capacity. Using appropriate exercise intensities and rest intervals allows for the selection of specific primary energy systems during training. Because this approach is more reflective of the actual metabolic demands of the sport, it results in more efficient and productive training regimens for specific athletic events with various metabolic demands. Interval training is a method that emphasizes bioenergetic adaptations for more efficient energy transfer within the metabolic pathways by using predetermined intervals of exercise and rest periods known as work-to-rest ratios. Properly spaced work-to-rest intervals allow more work to be accomplished at higher exercise intensities with the same or less fatigue than during continuous training at the same relative intensity. An early study compared the total running distance, average oxygen uptake, and blood lactate concentration during continuous running for 5 minutes and interval running totaling 30 minutes with different work-to-rest ratios. Subjects were assigned a continuous running intensity that would result in fatigue within 5 minutes, covering 0.81 miles before exhaustion. Using work-to-rest ratios of 2:1, 1:1, and 1:2, and the same running intensity for a total duration of 30 minutes, these subjects were able to complete significantly greater distances, 4.14 miles, 3:11 miles, and 2.07 miles, respectively, all while working their aerobic capacity similarly to the continuous running condition. Therefore, much more training can be accomplished at higher intensities with interval training. This concept has been established for many years. Recent studies have demonstrated improvements in muscle oxidative potential, muscle buffering capacity, muscle glycogen content, and time trial performance with interval training. When determining the proper work-to-rest ratio for athletes, knowledge of the time intervals, intensity of work, and recovery periods for each of the energy systems is critical to maximizing the amount of work that can be accomplished for a given exercise intensity. For example, after a bout of maximal exercise that depletes CP stores, the complete resynthesis of CP may take up to 8 minutes, suggesting that short duration, high intensity exercise requires greater work-to-rest ratios due to the aerobic mechanisms that replete phosphagen stores. In contrast, as the goals of training change to longer duration, lower intensity tasks, the durations of the work intervals can be longer, lengthening the rest periods and decreasing the work-to-rest ratios. General guidelines for work-to-rest ratios can be designed to emphasize the development of specific energy systems based on the theoretical time course for metabolic system involvement and substrate recovery. High-intensity interval training involves brief, repeated bouts of high-intensity exercise with intermittent recovery periods. High-intensity interval training typically incorporates running or cycling and is an efficient exercise regimen for eliciting cardiopulmonary, metabolic, and neuromuscular adaptations. It is considered one of the most effective forms of exercise for improving physical performance in athletes. High-intensity interval training is often discussed in terms of duty cycles involving a high-intensity work phase followed by a lower-intensity recovery phase. It has been suggested that several variables can be manipulated to achieve precise metabolic specificity, including the intensity and duration of both the active and recovery portions of each duty cycle, the number of duty cycles performed in each set, the number of sets, rest time between sets, recovery intensity between sets, and the mode of exercise. The intensities and durations of the active and recovery portions of each duty cycle are the most important factors to consider. To optimize high-intensity interval training adaptations for athletes, high-intensity interval training sessions should maximize the time spent at or near maximal oxygen uptake. More specifically, the cumulative duration and intensity of the active portions of the duty cycles should equate to several minutes above 90% of maximal oxygen uptake. The benefits of a high-intensity interval training protocol designed to repeatedly elicit a very high percentage of maximal oxygen uptake are primarily the result of the concurrent recruitment of large motor units and near maximal cardiac output. Thus, high-intensity interval training provides a stimulus for both oxidative muscle fiber adaptation and myocardial hypertrophy. The strength and conditioning professional should consider several factors when designing a high-intensity interval training program. For example, a 400-meter sprinter would need a high-intensity interval training program geared toward anaerobic-based durations and intensities more than a 3,200-meter runner. Other considerations for the desired training adaptations are periodization, similar to that for resistance training, and the number of exercise sessions per day and week. Periodization allows for the general development of aerobic and anaerobic systems during the preseason, transitioning to sport-specific high-intensity interval training sessions during the competitive season. Some suggest that aerobic endurance training should be added to the training of anaerobic athletes, a process known as combination training or cross-training to enhance recovery, as it is postulated that recovery relies primarily on aerobic mechanisms. Several studies have demonstrated that recovery in power output is related to endurance fitness. However, aerobic endurance training may reduce anaerobic performance capabilities, particularly for high strength, high power performance. Combined anaerobic and aerobic endurance training can reduce gains in muscle size, maximum strength and speed, and power-related performance. Although the exact mechanism is not known, it has been suggested that combination training may increase training volume to a level that may result in overtraining compared to aerobic or anaerobic training alone. Other mechanisms that may hinder the development of strength when combined with endurance training include decreased rapid voluntary activation, chronically lower muscle glycogen levels that can limit intracellular signaling responses during resistance training, and fiber type transitions to slow twitch fibers. On the other hand, some studies indicate that anaerobic training, such as strength training, can improve low and high-intensity exercise endurance. For example, highly trained runners showed improvements in performance as a result of concurrent endurance, resistance, and plyometric training without a reduction in maximal oxygen uptake over 12 weeks. While oxidative metabolism is important for increased post-exercise oxygen uptake, lactate removal, and phosphocreatine restoration from heavy anaerobic exercise, Care must be used in prescribing aerobic endurance training for anaerobic sports. Specific anaerobic training can stimulate increases in aerobic power and enhance markers of recovery. Therefore, extensive aerobic endurance training to enhance recovery from anaerobic events may not be necessary and may be counterproductive in most strength and power sports. Training programs can be designed more effectively by understanding how energy is produced during various types of exercise and how energy production can be modified by specific training regimens. Which energy system is used to supply energy for muscular contraction is determined primarily by the intensity of exercise and secondarily by the duration of exercise. Metabolic responses and training adaptations are largely regulated by exercise characteristics such as intensity, duration, and recovery intervals. Understanding how these responses and adaptations occur following physical activity forms the basis for the metabolic specificity of exercise and training. This principle allows for enhanced athletic performance through the implementation of improved training programs.